Welcome once again to my YouTube channel. And in succession to the videos what I have been taking up in pediatric dentistry. So today's video I'll be discussing about very importantly one of the very important topics what is being asked in the pediatric dentistry or as well as in the pediatrics. So in this video we'll be talking of the neonatal reflexes. So neonatal reflexes, when we talk whenever a newborn is born, so there are certain actions which are involuntary and which happen by itself. So neonatal reflexes are the inborn reflexes which are present at birth and they occur in a predictable fashion. Alright, a normally developing newborn is going to should respond to certain stimuli with these reflexes, which eventually becomes inhibited as the child matures. So in this video we will be discussing about some of the very important neonatal reflexes. The first is the rooting reflex. So rooting reflex is that reflex in which you can find that whenever the stimulus is being elicited on any corner of the mouth, or the gently we are going to stroke the infant's mouth at the angle of the mouth or on the corner of the lips or the cheeks, what is going to happen is the normal response of the infant will be that the infant's head is turned towards the stimulated side with the mouth wide opening. So in this rooting reflex, it is very frequently seen that whenever any side of the mouth is stimulated, the child is going to move the head towards that side with the mouth wide opening. So the appearance of this rooting reflex is that it appears at birth and is inhibited between 6 and 12 months of age. So between the ages of 6 and 12 months, this rooting reflex is going to disappear. So the appearance and the exit is that that rooting reflex is appearing at birth and is inhibited between the ages of 6 and 12 months. Now we move on to the very important, the next is the Moro's reflex. Now in this Moro's reflex, what is found is that this Moro's reflex, you must have seen that certain newborns, whenever just after the delivery, when the newborn is there, whenever there is a sudden noise or a sudden movement is there, the infant gets stimulated, and what is going to happen is the neonate will immediately respond to that loud noise or sudden movement by throwing away his arms. So the infant is going to throw away his arms out, and this is in response to a sudden sound, or there is a sudden movement. In such cases the infant is going to throw away his arms. So this is actually the Moro's reflex. The neonate will respond by throwing out the arms and legs and then pulling them towards the body. So later on the infant, once the sudden stimulus, sudden noise or sudden movement is stopped, the infant slowly and gradually brings back the arms what are being flexed. So this is the Moro's reflex which is seen in the newborn. And when we look at the appearance and the exit of this, so what do we find is that the emergence of Moro's reflex is round about, it starts in the intrauterine life between 8 to 9 weeks in the utero, and later on, and it is inhibited by 16 weeks of age, means by at least 4 months of age this Moro's reflex will be gone. Now the next important reflex, what is the neonatal reflex? It is the Landau reflex. Now in this Landau reflex, what do we find is that the infant is going to, when the newborn baby is being put on the surface with the tummy side facing towards the surface. So when the neonate is placed on their stomach, what is going to happen is the back is going to arch and the head is going to raise. So this is the Landau's reflex, and this emerges at 3 months of age postnatally and last until the child is 12 months old. So students and viewers, this was a very short discussion about the neonatal reflexes, and these neonatal reflexes, as I have already said, that the child is born with certain inborn reflexes which are present at birth and occur these reflexes, they occur in a predictable fashion. So a normally developing newborn should respond to certain stimuli with these reflexes, and eventually they become inhibited as the child is maturing. So students and viewers, this was a very short discussion. If you still have any queries or comments, you're most welcome to comment me in the comment section. And students and viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.